POEM is now a widely used treatment for patients with achalasia and has been demonstrated to be non-inferior to surgical helemyotomy and superior to balloon dilatation. This paper, published in Endoscopy this month, looks at the risk factors and long-term course of gastroesophageal reflux disease in patients after they've undergone a POEM. It's a multi-centre study from 14 high-volume centres in Japan with almost 3,000 patients included. They aim to determine if there were risk factors for patients who would get esophagitis or symptomatic reflux after a POEM. This was a particularly well-timed paper for me, as I recently had a patient who turned down a POEM in favour of surgical myotomy, as he was concerned about the risk of reflux after a POEM and would have preferred to have a surgical myotomy with a fundoplication. The data collected in this paper were the duration of symptoms, age at POEM, sex of the patient, body mass index, history of previous treatment, the Eckhart score, manometry diagnosis, integrated relaxation pressure, esophageal dilatation, PPI use, and achalasia type. And these patients were followed up over 5 years. Now, reflux esophagitis was more commonly seen in patients who were over 65 at the time of their POEM. It was more commonly seen in patients who were male, also those who had a posterior myotomy, and those who had a more extensive myotomy, though in particular on the esophageal side by over 10 centimetres, and on the gastric side of over 2 centimetres. Severe reflux esophagitis was associated with those who again were older, over 65, those who'd undergone previous treatments, those who had an Eckhart score of over 7, patients with the sigmoid type achalasia, and again, those who had a more extensive myotomy, particularly those who had an esophageal myotomy of over 10 centimetres. Now, actually, importantly, we need to talk about symptoms though, and actually symptomatic reflux was only found in 16% of patients at 3 months, and those with a symptomatic and those particularly occurred in people who had a symptomatic duration of over 10 years, those who had integrated relaxation pressure of over 26, patients with a sigmoid type achalasia, those with a posterior myotomy were most likely to get symptomatic reflux. Interestingly, however, the incidence of symptomatic reflux declined over time, and actually only 9% of patients reported symptomatic reflux at 5 years. So what does this paper mean for the future of POEM? One can certainly advise patients over 65 that they are higher risk of post-POEM reflux, reflux esophagitis, but actually that overall risk is 16% at 1 year and 9% at 5 years. In this paper, they suggest that it's not recommended that patients over 65 have an excessive esophageal or gastric myotomy, as this does seem to increase the risk of them developing symptomatic reflux. Patients with a sigmoid type achalasia are also at higher risk of symptomatic reflux and therefore should be counselled accordingly prior to their POEM. Importantly, however, in this study, the natural course of reflux after a POEM was acceptable, with the incidence of severe reflux esophagitis after a POEM being low and the natural course being favourable, where this paper can suggest that actually only conservative approaches are needed. There of course have been discussions about whether one can combine a POEM with an endoscopic fundoplication technique, but this paper wouldn't support that and in fact suggests that PPI therapy is all you need. So we're certainly going to see POEMs being used more and more as a preference in the treatment of achalasia, and as such, of course, more data is going to come. For now though, watch this excellent demonstration on how to perform a POEM by Dr. Matthew Banks.